In 10 years, we went from $30 billion at NIH to $48 billion, an $18 billion increase in medical research at NIH. I couldn't have been prouder of all of our bipartisan efforts to do that. This year, your budget wipes it out completely. Wipes out $18 billion that we fought for over 10 years. And I can't understand that. I disagree with this administration on so many things, but this is the one that really gets to me personally. To think that this nation would walk away from medical research. For God's sake, we lead the world in medical research. Why would we give up on it? I look at the specifics here. Cancer. 2025, 2 million new cases of cancer will be diagnosed in the United States. 600,000 people will die from that disease. Yet your budget requests a 38% cut. 38% to the National Cancer Institute. How are you able to reconcile these budget decisions with the reality of research and what it means to alleviate suffering and, more importantly, to give people hope? If research is underway, you at least have the hope that maybe there'll be a cure, maybe in the lifetime of someone I love. How can you walk away from that?
Well, Senator, my intention not to walk away from that. I mean, I think that—
But the budget speaks for itself. You cut $18 billion in research.
Well, Senator, the budget is a collaboration between Congress and the administration. So, you know, I look forward to talking about the advances that NIH researchers have made. I mean, I think the transition has been a very bumpy time, and I don't mean to like downplay that, but there have been opportunities for reform for how the biomedical research enterprise works. I think the decisions about Northwestern happened before I got into office, but let me just say that
The buck stops in your office.
I know it
now.
does. So let me just say that
Don't blame another person.
I'm not blaming anyone.
We're asking you, and you're in charge.
Senator, I agree with that. So let me just say that I think that the way that the universities operated during the pandemic didn't always make it easy for scientists to do their work. I can tell you that personally from being a professor, and I think some of the
But eliminating grants, eliminating research, how can that solve the problem?
There's been a lot of talk about the difference between direct costs, spending the money, for example, on research and cures for nephritis, and indirect costs, overhead. Harvard, for example, with a $53 billion endowment, spends 69% of its money from NIH on overhead, does it not?
I haven't looked at the latest numbers, but it's definitely in that range.
Yale spends 67.5% on overhead, does it not?
Again, roughly in that range, yes.
So all this money spent on overhead is money that's not being spent on medical research, is that right?
Well, it's for fixed costs of like lab space and things, but also sometimes for other things. So it's some of it's absolutely necessary.
Well, if I'm the Gates Foundation, and I came to the NIH and said, I don't want money. I want to give you money. I want to give you $100 billion.
Yeah.
But you can't spend more than 10% on overhead. Would NIH turn it down?
I wouldn't turn it down, no. In fact, I think that Gates Foundation overhead rates are roughly, again, in that range, 10 to 15%.
The Trump administration is already systematically dismantling the American biomedical research enterprise that is the envy of the world, throwing away billions in economic activity in every one of our states and jeopardizing the life-saving work of researchers across the country. This budget proposal would effectively forfeit our leadership in research innovation and competitiveness to China. It would mean we depend on China for the latest treatments for devastating diseases. No one in America wants us to do less cancer research. No one is asking you to make it harder to research Alzheimer's disease. And no one is asking you to cut life-saving clinical trials. We're hearing this from the experts themselves. You just received a letter signed by hundreds of your own staff who believe this administration's actions risk breaking NIH and the life-saving work it does. I really hope you heed their warning, and it should go without saying, but I expect none of them to face retaliation for raising those concerns. Everyone on this dais wants NIH to succeed, and you're going to need to see some major changes from what you are doing right now to get us back on the right path.
Cutting ongoing trials, I think, doesn't save money. It actually costs money. And it wastes years of prior investments and abandons the patients who have depended on this research.
Senator, I think the budget is a negotiation, a collaboration between the administration and Congress, and you'll have your say. I think for my job is to make sure that the funds that you all appropriate to me go to advancing and meeting the health needs of the American people. And I think that's that's a productive thing. I'm hearing from basically everybody that the NIH is really valued in Congress, and I find that gratifying. I value the NIH, and so the administration, President Trump has committed that the U.S. be the leading nation in biomedicine in the 21st century, and I entirely support that goal.
Well, I do too, but it's hard to understand how we're going to get there when the budget slashes funding, particularly in critical areas of research.